It has the highest COVID-19 mortality rate in Asia, hovering at around 8 to 9%. Indonesia also has the most number of coronavirus deaths in the region, second only to China.
To be honest, the government's early response of their tackling of the COVID-19 pandemic has been substandard from the very beginning. If you recall, earlier in the year when China, when South Korea, Singapore, countries around the region started declaring their coronavirus counts, Indonesia was still very much in denial about how many cases they had. They even declared that they didn't have any COVID-19 cases well until early March.
Indonesia has been ramping up its fight against COVID-19. But there's concern that the move may have come too little, too late. Indonesia's health ministry has admitted that the mortality rate of 9% is much higher than the global average. But the true number of COVID-19 related deaths may never be known.
The majority of observers know that the figures that are being released by the government is perhaps far from accurate. If we look at the numbers of admissions to hospitals alone, if we look at the numbers, the higher levels of mortality rates across cities, across Indonesia alone, we know that this number is not correct. So the danger of using this kind of figures as a measure to how well Indonesia doing is dangerous because it's just simply misleading.
Does Indonesia, a country known for its inadequate medical infrastructure, have the resources to handle the rising number of patients?
Indonesia has one of the lowest testing rates in the world. So far, the country has only tested around 108,000 people, which means it has tested only around 319 people per 1 million population, which is much lower than Vietnam, for example, who has tested more than 2,600 people per 1 million population.
Indonesia faces a severe shortage of vital breathing devices to treat people with the disease. According to the Health Ministry, Indonesia has just over 8,000 ventilators nationwide for a population of 270 million people. It also has 2.7 critical care beds for every 100,000 patients.
And then we look at the number of hospital and number of physicians or doctors. They're all far below the demand.
According to a 2017 WHO survey, the country only has 4 doctors for every 10,000 people, well behind Malaysia, which has 15 in terms of doctor-to-patient ratio. There's been an extremely high mortality rate among healthcare workers. As of early May, the pandemic has killed 38 doctors and 17 nurses.
This is due to lack of facility, lack of PPE, for example. Indonesia's healthcare at the moment is on the brink of breaking down because there's just so many patients.
Pernah disampaikan bahwa ini kita masih di fase awal gitu, yang mana begitu nanti pertumbuhan tinggi tenaga medis sudah nggak mencukupi lagi, baik dari sisi fasilitas rumah sakit, kamar, maupun tenaga medis sendiri, karena tenaga medis terbatas.
President Jokowi has reallocated some $26 billion from the 2020 budget to fund the fight against COVID-19. The government has also recently built a specialist hospital on Galang Island in Riau to treat COVID-19 patients from across the nation. A team of Indonesian engineers are also working around the clock to produce compact ventilators.
Of course, these have to be supported by follow-up policies so that these steps could be effective.
But in a dramatic turn of events, the government has signaled that it will ease some of the social restrictions to curb the spread of the virus. This is despite criticisms from epidemiologists who warned against easing such restrictions too early unless it has strong evidence to show that the coronavirus curve has been flattened. Amid the economic downturn caused by the COVID-19 outbreak, according to government estimates, some 5.2 million people will lose their jobs, and almost 4 million Indonesians will fall into poverty.
Indonesia is facing a tough choice at the moment, right? Whether to safeguard its economy or save the lives of its citizens. And a lot of governments around the world are facing the very same choice right now. When to open up restrictions, what to do next.